Okay, this is a great question. So when we're talking about what exactly are the symptoms of pelvic floor dysfunction, it's kind of a loaded question, so I'm going to try to squeeze it all into this 3-minute video. So as we all know, the pelvic floor is responsible for urinary function, bowel function, sexual function, and then overall support of our bodies. And so when we're talking about urinary symptoms, you can have things like urinary urgency or frequency, having to pee really bad or having to pee all the time. There's urinary retention, not fully emptying your bladder. There's urinary hesitancy, so it takes you a long time to even start a urinary stream. There's, if you have to get up in the middle of the night to pee a lot, excessively, that's called nocturia. That's not normal. Common, but not normal. Could be attributed to pelvic floor dysfunction. Pain with urination. Urinary incontinence, whether that's stress urinary incontinence or urge urinary incontinence, leaking with laughing, coughing, sneezing, or leaking whenever you have to pee really bad. Common, not normal. In terms of bowel function, so pelvic floor dysfunction can be contributed to constipation or diarrhea or IBS, the combination of the two. Hemorrhoids or fissures or tears in the rectal canal could be attributed to pelvic floor dysfunction or an overactive pelvic floor. When we're talking about sexual dysfunction, pain with penetration, pain with orgasm, pain with ejaculation, just general vulvar or penile pain, pain in the shaft of the penis, or pain in the vagina or the vulva, could be attributed to pelvic floor dysfunction. When we're talking about just general body support, we're looking at, piriformis syndrome or obturator internus pain that I just did a video about, the pain in obturator internus. When we're talking about postpartum or during childbirth, there's pubic symphysis dysfunction, or there's prolapse, whether that's bladder prolapse or uterine prolapse or vaginal wall prolapse or rectal prolapse. All of those things are common in postpartum or in postmenopausal women. There's also conditions like endometriosis or interstitial cystitis or prostatitis or chronic pelvic pain syndrome. There's a whole bunch more, but they all could be attributed to or could develop pelvic floor dysfunction from those diagnoses. I'm not going to say they cause those conditions because they don't, but you can develop pelvic floor dysfunction from those, and getting pelvic floor therapy can help manage the symptoms of those diagnoses. I hope that makes sense. I'm sure I've missed a lot of conditions, but in terms of like the big bullet symptoms, erectile dysfunction, not to mention that, erectile dysfunction could also be attributed to pelvic floor dysfunction. I know I've missed some, but those are the big bulk, like I said, big bullet point items. Hope that helps.